Good morning to everybody. Today we'll see another case of a lady of 62-year-old. She was admitted with a 2-day history of severe abdominal pain and vomiting. There was a right-sided abdominal pain. She felt febrile. There was chills with that. There is no history of cough. There is no history of expectoration or chest pain. The pain was constant in the right hypochondrium without any radiation, and she had never been able to eat or drink in this particular period of time because of this illness. Her clinical examination showed she was febrile. She had 101 degree Fahrenheit temperature. She was having hypotension 90/50. Obviously there was a tachycardia. The pulse was regular, 120 beats per minute. GBP was not raised. There was no anemia, no clubbing, no lymphadenopathy, and there was no thyroid enlargement also. She was mildly icteric and she was quite dehydrated. Her abdominal examination showed there was marked guarding and tenderness in the right hypochondrium. There was no hepatosplenomegaly. There was no ascites. Her other clinical examination of respiratory system, cardiovascular system, and neurological system was normal. Clinical investigation reveals that she has normal HB of 14.8. This appears to be little hemoconcentration. Total WBC count, look at this, 24,000. Her platelets were normal. Her ESR was 73. Electrolytes were normal. Look at the blood urea, it was 48, but the creatinine was raised to 1.5 milligram per dl. She had hypoalbuminemia, where albumin was 2.8 gram per day. Bilirubin was little raised, 1.6. Total bilirubin still. E. coli was the blood cultured growth, and it was sensitive to cephalosporin. Last 24 hours, she could pass only 90 ml of urine. ECG and chest X-ray were normal. So this particular patient, fever, chills, right hypochondriac pain, vomiting. She had raised WBC count. She has acute kidney injury where creatinine was 1.5. She had hypoalbuminemia, 2.8 grams of albumin. So looking at this particular case history, what is your diagnosis? What are the common organisms which leads to this particular illness? What diagnostic test we should ask for? What are the common sources of these organisms? What antibiotic we can give to these conditions? And what is the long-term prognosis of this particular patient? Let's find the answer for this.